Dogs have been companions of humans for years. In the past, they used to help at the farm. Now they are simply domestic pets, often treated as family members. What keeps dogs healthy and happy is the possibility to move, run, play with the owner and other dogs. Any injury or disease within the locomotor system means that the dog avoids physical exertion and ceases to fulfill its natural need to move. This was the case of Lord, the 5-year-old Labrador Retriever who 2 years ago tore the cruciate ligament in one leg. After the surgery, the dog returned to fitness, but unfortunately, 18 months later, he tore the ligament in the other leg. During exercise, even a short walk, he simply limps, drags that leg behind him. Cannot play with other dogs because he cannot accelerate so much. He's not so swift. It is difficult for him to climb the stairs. And if the surface is slippery, he cannot get up. When he's in pain, he gasps intensely. There are times when he just suffers because of it. After consulting the vet, the decision was made to operate on Lord. The best clinical effects, the ones that allow the animal to return to full activity, are treatments called osteotomies. These are treatments during which we cut the bone and change the plateau, which is the bone surface of tibia to femur, and this causes the forces in the knee joint to be neutralized and the joint is thus stabilized. Stabilized with a special implant, the use of which, however, is tied with the possibility of two side effects. The first issue is the so-called metallosis, the body's reaction to metal ions that may escape from the implant. The other problem is drug resistance, which may occur when an animal is given a lot of antibiotics to prevent infection within the wound. Scientists from the AGH University of Science and Technology in Krakow decided to face the challenge and create a special coating on the implants. The antibacterial composite layers we developed are designed to perform a bactericidal function against gram-positive and gram-negative bacteria, and also to protect the surface of the implants against surgical scratches that appear during the operation. This coating is also to protect the implant surface against the release of metallic ions from the implant into the biological environment. Hybrid organic-inorganic layers are applied to the previously prepared metal implants by the so-called sol gel method. It consists in immersing the material in a prepared solution and then subjecting it to the gelling process. Thus, as a result of chemical reactions, the coating is formed. The most innovative thing here is the chemical composition of our solution, which is to ensure a stable coating on the metallic implant, a substrate with completely different mechanical and material characteristics. The finished coating is hardened in an oven at a properly selected temperature. Then, silver nanoparticles appear on its surface to ensure bactericidal effect. The implants prepared in this way, after confirming their biological compatibility and demonstrating antibacterial and antifungal properties, entered the phase of clinical trials. The implants covered with the new coating were placed in 6 dogs, among them Lord. What makes this implant unique is the fact that we don't use antibiotics after the procedure. This is important because antibiotics are generally used in many cases. Of course, their use has advantages, but on the other hand, we have antibiotic resistance among bacteria, so in general we try to use them as little as possible. months after the treatment, the effects are visible to the naked eye. The dog's owner points out a significant difference in the dog's recovery after the operations involving a traditional implant and the new implant.
Pies zdecydowanie szybciej doszedł do siebie.
The dog recovered much faster. During the first nights after the surgery, he was definitely better. He had less pain as compared to the previous treatment. And it was obvious that the dog started to take steps much faster. He just started to walk normally.
Zaczyna podejmować kroki, zaczyna chodzić normalnie.
Both vets and scientists agree that the use of new types of implants should become the standard in surgical treatment of animals. The use of implants with a bactericidal and bacteriostatic coating is a huge progress in the field of implantology because it is associated with a significant limitation or even complete limitation of the antibiotics administration in the post-surgical period. We hope that our study will be commercially available to all vets because the current solutions that are available on the market are ordinary metallic implants without antibacterial coatings. The discovery of scientists from the AGH-UST is an undoubted breakthrough in the field of veterinary surgery. Thanks to the use of an innovative coating of implants, the recovery period is significantly shorter. Dogs faster recover and regain their natural functionality. We are very happy that we can go for long walks with him, that the dog can run freely after the stick, follow the ball, play with other dogs. He's also happy. You can say that the dog has returned to our family.